Yes, dear viewer, many thanks for joining us on Aneke TV today. The program remains the arena, and this is where we meet to take on issues, matters facing us as a people in society. So you're welcome on board. My name is Chris Anibo, thanking you for having joined us. Today, our train is headed to the health sector. It is World Hepatitis Day, and these are our own way of speaking to this health issue called hepatitis. And today, to help us do justice to this discussion, is a man from the medical world. Well, a lengthy profile he's got here. He is the first Vice Chairman, Association of Professional Bodies of Nigeria, Enugu State Chapter, the immediate past Chairman, Association of Medical Lab Scientists of Nigeria, Enugu State Chapter. But then he's coming from the University of Nigeria Teaching Hospital. He took us at Enugu here, where he's serving as the Assistant Director, Medical Laboratory Services. Dr. Ejiofor Mama, you're welcome to Aneke TV.
Thank you so much.
It's a pleasure having you.
You're welcome.
All right, let's the discussion on food. How much do you know about hepatitis? Well, Doc, it's for you to tell us more about it. Hepatitis. What is this one again?
Thank you so much,
What is this one now?
my uncle. Today being the 28th day of July 2025, the world is commemorating the work of an American physician and also a geneticist. He worked tirelessly to ensure that we brought an end to a disease we call hepatitis. And he went deep to find out that one of the causative agents of this hepatitis is hepatitis B. Yes, hepatitis B. He did not only discover it, he also developed a technique of diagnosing it. He didn't end there. He also went forward to ensure that it is preventable. Yes, by getting the means of vaccinating it. And the name of this person is Dr. Samuel Barock,
Okay.
an American. And he was born on the 28th day of July, 1925.
Oh.
And eventually died just a year when, after the World Health Assembly recognized his importance in medical field, because he also won a Nobel laureate. That was in 2010. That was when the World Health Organization, in collaboration with World Hepatitis Alliance, came together and said, okay, this man will have to honor him on every 28th day of July. That was in 2010. So, but shortly after, fortunately, on the 5th day of February, 5th day of April 2011, the man passed on. And since then, we're commemorating this day. So, coming to your question,
Yes.
hepatitis just means inflammation of the liver cells.
The liver cells.
Yes, when you hear the word hepa, it means liver. And when you hear the word titis, always whenever you see titis in medics, it means inflammation. And a lot of things can cause this inflammation of the liver cells. And one of them is this viral infections. Because when you come to this hepatitis, it can be grouped into two. The one caused by viral agents, and then the other one caused by non-viral agents. So those ones caused by viral agents can be caused by hepatitis A, hepatitis B, hepatitis C, hepatitis D, or hepatitis E. They are all 5 classes.
Okay.
And then the non-viral one could be caused by auto antibody.
What is that supposed
When
to
we
mean?
see antibody, like in layman's time, it means the system fighting itself. Just like a policeman that is hired to protect the citizens suddenly tells you that there is accidental discharge. This could be caused as a result of genetic factors, or even the environmental factors we are facing can just trigger the immune system, and the system starts fighting itself, fighting the liver cells, and by the end of the day, there is inflammation in the liver. Another one that could be this non-viral cause is alcoholic. There's one we call alcoholic liver cirrhosis. For most people who are much dwell in consumption of too much alcohol. One who cannot just stay without alcohol might have inflammation of the liver cell, which we call the hepatocytes. And by the end of the day, you find out such a person has inflammation of the liver cells. And apart from that, there are other conditions like medication.
Medication.
When you take some toxins, it also affects the liver cells. And if you are not careful, you might damage it beyond repair, unlike that of alcoholic liver cirrhosis, which when you stop, depending on the extent you have taken it, they could reverse. But when it comes to the toxin, as well as that of any poison, it can hardly reverse. And besides that, we have other agents like some of the drugs, like maybe even expired drugs, and that is why I always tell people, do not self-medicate. And when you take overdose of drug, it can also cause this liver cirrhosis. And some agents like most people who have the habit of when you put on a insecticide in the house, you enter there. It has the same features as B and C. So I'm just taking it one step after the other. You can get it from bodily fluid, from the woman, and the worst of it is that the mother can transmit it to the innocent unborn. Yes, and that is why it's dangerous. And without all these things, people may not know. But my joy is that there is a system on ground to curtail this.
There is a system.
And when the system on ground will get out to the blood prevention stage, we'll talk about that.
That's right.
So when we now talk of B and C, they have the same characteristics. You can get it from sex, you can get it from sharp objects. Most of these young guys that believe they belong somewhere, they belong in a group because of initiation, they use the same sharp object to incise their whatever sign they have, the same sharp object. You could get hepatitis B through that. You could get hepatitis C through that. And also, unhealthy medical practices, if you don't really, take care of your syringes very well, maybe people who reuse syringe, but these ones are common with, these classes of people who belong to, the drug addicts, who take drugs.
When they inject,
inject, you drop it, your man will come, and also use the same needle to pick the drug and inject. With that, you will be able to also get this hepatitis B. And also, I think apart from all this type of transmission is common. And also, another one is that we can get it from blood and blood products.
Okay.
Hospital, which I wanted to say earlier, if you are not following the medical procedure, proper screening of blood before transfusion, one could get it, even in blood product. And also, the health professionals are also exposed to that because by working, you may have what we call needle stick injury.
Okay.
Because of accidental prick of needle can get you infected or fixed.
That's now part of a work hazard.
Work hazard. And with that now, we now migrate to hepatitis D. The hepatitis D we are talking about is also called delta hepatitis. And
you call it what?
Delta hepatitis.
Delta.
Yes.
Okay. What does that? Whatever that means, anyway.
So, and also we call it a satellite hepatitis because it cannot stay on its own. It cannot stay on its own. It's dependent on the infection of hepatitis B. If you don't have hepatitis B, even if you are infected with D, it will not really be dangerous. It will not resort to disease condition because there's what we call envelope. It is hepatitis B that provides this wall for it, which we call envelope.
It's like a feeder.
So once it is not protected, it will not be able to live long. And with that now, you find out that it's largely dependent on the existence of B. And the good news about all this is that that one that is dangerous has a preventive measure.
All right, we're going to pause it there because we want to go on a very quick break. So that when we return, so far so good, we've been able to, lay the background to what hepatitis is all about. We've looked at the causes and the mode of transmission of this killer. But then when we return from this break, we'll be looking at symptoms, even mode of manifestation, and then what we need to do is that by preventive measures or even by curative measures. We're going to know all of that when we return from the break. He's still here with us. Dr. Ejiofor Mama is here to talk to us on what we need to know about hepatitis. Stay with us, don't go away. Welcome to Aneke TV, the heartbeat of culture, truth, and innovation. From breaking news to inspiring documentaries, from grassroots traditions, mysteries of life to global perspectives, we'll tell your stories. We amplify your voice and your vision. With every screen we light up, we connect, inform, and empower. It's more than a television. This is Aneke TV. We move with the world. Okay, dear viewer, thanks for returning with us on the show, on the arena, on Aneke TV, as we are looking at hepatitis. Mind you, it is the World Day on Hepatitis. And this is our own way of talking about it, so that you, the viewer, could be better informed and educated about it. So, Dr. Ejiofor Mama, can you quickly, I don't know how much time we've got to run on this segment now, but then we need to know, how does hepatitis, be it A, B, C, down to the E, present, for instance, symptoms in patients?
Just because of what of time, I would have taken you through the processes of, functions of the liver, so that when we now talk of hepatitis, you know why some symptoms are presenting. But later, maybe in next edition,
just go ahead.
No problem. So the liver is the largest gland in the body. I think it's good to tell you that it is located at the upper quadrant, just right upper quadrant, slightly, below the diaphragm, somewhere. So it runs this way, and from here down, just like a wedge that's stretching from your right side down to the left flank of it, and it does a lot of functions. It helps in metabolizing any food you take. It detoxifies waste, and also provides some essential enzymes that will help your body to work. And once it's not working proper, you find out that the waste we are generating might eventually not be excreted properly, and at the end of the day, it might lead to, presentation of yellowish eye, and also, in advanced case, bloated abdomen, fever, nausea, and even to the extent of having swollen extremities when the liver is not working, because it helps in the metabolism of the food we are taking. If it is not working, the food we are taking might not be properly digested, and the amino taken well absorbed and not be properly utilized. And in the end, you find such a person even losing weight. So those are the symptoms that hepatitis is always presenting.
What about swollenness of the feet, of the face?
That's what I'm saying. Swelling of extremities. That's
Okay.
what I mean by that. So the legs will be swollen, the abdomen will be swollen, and the skin will be yellowish, the eye yellowish. You find that such a person will be having what we call weaknesses. You can have weakness. You will not be able to do anything. You will not be able to even do your routine things. And in extreme cases, it can also lead to insomnia. People will not be able to sleep because anxiety might even come in, because mentally such a person will not be stable. So those are the symptoms.
Wow. And then what about cure now? Okay. Is hepatitis curable?
Hepatitis,
is it treatable? For instance, we consult you in the hospital, and then...
There are difference between treatable and curable diseases.
Okay.
So when we talk about the curability, hepatitis C can be cured.
C can be cured?
Yes. And I told you earlier that A and E can, take care of themselves. So if the C that D is dependent on can be cured. They found out that we have eliminated all the other viral except one, which is B. And it is only B that cannot be cured, but it is treatable.
It's treatable.
It is treatable and it's also preventable.
Let's look at the preventability before we look at the treatment now.
Okay. So since year 1995, there has been vaccine for the prevention of transmission of this hepatitis B virus. And in 2004, the former President Olusegun Obasanjo was able to bring this vaccination to the country for compulsory purposes. And once a child is below 5 in the country, since 2004, it is mandatory that such a baby should be vaccinated against hepatitis A and B as well, but mainly focus on B. That one is preventable, and also adults. Adults can also, those adults that are born after 2004 can get the vaccine. And once you take a complete dosage of that vaccine, it will prevent anybody that took that vaccine from getting infected. And the only thing you do is just, depending on the brand of the vaccine you take, it could be repeated every 10 years so that you boost your immunity. You boost that dose of it. You take it after 10 years of your previous vaccination. And I think the ones we took is always taken in 3 doses.
Okay.
First 1 month and then 6 months later. Once you take your complete vaccination, you are prevented from getting the hepatitis. And we encourage all people who are working in the health sector, and everybody, to ensure that this vaccine that is available should be taken by all. There's no any need for vaccine hesitancy, because what is our problem is that we always develop one myth or the other about vaccination. Some people might think that when you get vaccinated, it might cause one thing or the other. Remember the era of COVID. I was in almost all
those myths, you know.
And, I seated here. I took the vaccines there, and they were saying about 5 years. This is 2025. I think I'm even healthier than now. I'm healthier now than then. So I think this hesitancy should not come in. You take the vaccine so that you'll be able to. VA is also available, but I think government should also scale up a means of getting this really available to people. So
now, can we easily access this the vaccines at every health center?
Yes.
Yeah, they are the primary health centers.
Enugu State is trying about that, and I'm sure when you get to our primary health center, which is one of the key messages of this year's World Hepatitis Day, and we say we have to break it. We have to break the stigma behind this hepatitis B and hepatitis, all these hepatitis, viral hepatitis. We have to break the stigma, and also break the bottlenecks surrounding people having these vaccines. It has to be broken so that people really have access to vaccine.
Are there criteria before one will be able to access the vaccine?
One of the criteria for accessing the vaccine is that you must have to get tested. When you get tested and you are negative, that qualifies you from taking the vaccine.
But if one is tested and one becomes positive, what happens?
That is what we are advocating, because most countries are now on a program which we call tests and treat. So when you test negative, you take the vaccine. And when you take positive, you'll be enrolled for treatment. And the treatment is just not one-off. Apart from C, that is treatable, because with the presence of these direct acting antiviral drugs that is helping to treat the hepatitis C, there are some also antiviral drugs that people who have hepatitis B are using so that it to suppress the virus. And there is not only when you test positive, you rush taking drug. There are other procedures you have to follow. First of all, you have to know, has it got chronic? By running a test we call hepatitis B panel. is the coating in there, and all these things. And those ones, now those tests need somebody who is specialized in that area. It's not just something that a layman can do, or somebody, people who are running this hepatitis B screen can run. You need an expert to work that. And if he has already got to this chronic stage by, the typing, also, there's what we call viral load. Okay, how many copies of viruses of this hepatitis B that the patient is having? So that will now determine if the patient can now start treatment immediately, and then also. But now the World Health Organization is advocating that whoever tested positive, irrespective of the viral load, let the person commence treatment so that it will not suppress the virus. Just like HIV, because whoever tests positive in HIV always commences their treatment, and then the viral load will always be detected. And in the end, after the assay, you find out that if the drugs are working effectively, it will reduce the viral load to non-detectable level, and at that level, there will be no transmission of that virus to the next person, be it from mother, be it from couples, or any other.
The most worrisome part of hepatitis is the fact that it is transmittable from one person to another.
It's a communicable disease.
I'm telling you, so that's where it is very, very worrisome. But then I don't know, for the treatment, you've told us that that of C is treatable now.
Yes, it's curable.
It's curable.
And B is treatable.
And B is treatable.
Yes.
So where can it be treated?
In a hospital anyway.
Any hospital?
Most of this
primary, secondary, tertiary.
That is why we are advocating that Enugu State government to ensure that this B testing treatment should be present in all the wards, the 260 wards in Enugu State. The primary health centers there should be well equipped and make these services available so that our brothers in the remote areas could have access to diagnosis, which is very, very important, because you have to test before treating. And this such a person is positive, he has to commence treatment immediately. And if it is the other way around, that the person is free from viral infection, he should commence vaccination immediately, so that we'll be able to have what we call herd immunity, a situation where majority of the people of the states have the immunity against hepatitis B and A. You find out that the remaining few people will be protected by those people who have been vaccinated. And that is why it is also good for us to ensure that we employ professionals, because it is the professionals that will handle this. It's not just a mere test where you can just go and run the screening, hepatitis B screening, and
then maybe you commence treatment.
Once you test positive, a professional, a medical laboratory scientist has to come in to confirm the effectivity of that test. And thank goodness this time around, the vaccines are now being produced from bacteria, unlike before, which it was attenuated. And sometimes when test positive, we now try to confirm if it is a result of vaccination. But this time around, these current vaccines that are available since about 5 or 10 years ago now, is just from bacteria. There's no any fear for anybody getting hepatitis from the vaccines. And in the end, when you take it, you will find that it will prevent the transmission. And also a mother who is pregnant is advised to also carry out screening tests for hepatitis. If it's positive, he should commence treatment. And if negative, also take the vaccines. And there's a policy by World Health Organization in collaboration with World Hepatitis Alliance that any child born should receive this hepatitis B vaccine within 24 hours of birth.
That's interesting.
And that is why it is good for us to reach out to the people who are practicing maternity homes, the traditional birth attendants, educate them on this. So the government has a lot of work to do. And that is why I said we have the tools, but the situation in our hand is that there is no political will for us to drive it. Because a situation where the vaccines will be available and there is no advocacy for people to go and take the vaccine, and the vaccine will be in our primary health centers, and in the end, if I find that deteriorating and not even true, because we have storage devices anyway that can store it, but expiring without people taking it is not advisable. There should be much advocacy, And we should not only dedicate 28th day of July every year for
awareness around hepatitis.
Because as we are talking now, it's busy spreading. And the only way we can contain this is for us to ensure that we enlighten members of the public what this hepatitis is all about. That it is treatable if it is hepatitis B, it is curable if it is A, C, E, and you cannot get D without C. When you get all this information, it will equip you. And when there is a political will, the government will now have that zeal to ensure that the citizenry are protected.
All right.
At the end,
All
we'll
right.
be able to actualize the dream of World Health Organization that stated by year 2030 there will be no new hepatitis B transmission.
So that's the projection.
That is projection.
The year 2030.
And that started.
And this is
2016.
2025.
Just barely, I think 9 years ago. We'll have barely 5 years to go. So all these things are what we are advocating, that people should know your status. Go to the nearest laboratory, manned by professionals, run the test, and if it is negative, take the result to the nearest health center and get vaccinated.
Wow. A long list there. We must have to appreciate you, Dr. Ejiofor Mama, for your time in running this national service to educate our people and draw attention towards this very important health matter, hepatitis. So please go out there, have yourself tested. I think it should be free.
It's what we are advocating, that
Is it
government
free?
should subsidize this because it has to be integrated into HIV management.
Okay.
Because now the testing for this hepatitis, viral hepatitis, is not free.
It's not free.
It's not free. It's not free as to the best of my knowledge. It's not free.
But maybe the cost is not, it shouldn't be much.
It shouldn't be much, with average of between not up to 5,000 depending on the facility. But we are talking about when you go down to the government hospital, it is well subsidized. And that subsidy should also be sustained, and it probably, whatever is done to HIV should be done to hepatitis.
Hepatitis.
Because now HIV is free in all government hospitals, and even the viral load is free.
That is the vaccine against HIV.
No, there's no vaccine against HIV. I'm talking of testing.
Okay, the testing now.
Testing for
Is
HIV
free.
is free in government hospitals. The government, I'm also begging the government, more especially the governor of Enugu State, to ensure that testing on this hepatitis should be free across all the health centers in Enugu State. And not only that, we should also extend our hands to people who test positive. Those people who tested positive should be enrolled, and just as we are doing for people who are HIV positive, their viral load assay is free of charge. Viral load for people who have hepatitis B and C should also be free.
Free.
And even the drugs they are taking is free. For people to take this treatment, even from all this non-governmental organization, is very, very expensive. They should have to subsidize it so that at the end of the day, people who tested positive will have access to free drug, and in the end, people will now have the ability to come and access.
And that will ultimately make the society a healthy place, because it is said that a healthy people is a wealthy nation. Thank you again, Dr. Ejiofor Mama, for coming to this show.
Thank you so much.
Thank you very much. I appreciate you, sir. So there, viewer, that's the much we'll give you on today's edition on the arena on Aneke TV. Keep watching Aneke TV. Go get tested, get yourself treated, get yourself cured. Stay away from, predisposing factors. My name is Chris Anibog. Bye for now.